Hi, I'm Amanda.
I'm Jake.
I'm Jill.
And I'm Parima.
So, in the United States, approximately 12% of Americans are affected by migraines, and over 4 million of those adults live with recurrent chronic migraines. Recurrent chronic migraines are defined as highly disabling migraines that occur more than 15 times per month. These types of migraines are second in the US to only lower back pain in terms of years lost to disability and lost productivity, which is estimated to cause around $80 billion in the US in medical expenses per year. The cause of chronic migraines is currently not fully understood, and there is no current cure. There are current treatments, which can include pain relieving and preventative medication, as well as day-to-day life changes, all of which are lacking in personalized medicine and diagnostics. Migraines can manifest in multiple symptoms, one of which includes a visual aura, which 1/3 of people with chronic migraines suffer from. These auras often act as an alert to the patient that a migraine will soon start. Most patients with chronic migraines do not experience these auras, therefore they are often unaware when a migraine may occur, and this has caused a need for personalized warning notification to the specific patient that a migraine is about to start.
We will focus on monitoring the concentration of a vasodilator known as calcitonin gene-related peptide, or CGRP, in the saliva to alert patients to oncoming migraines days sooner than self-monitoring symptoms alone. CGRP levels in the saliva increase during a migraine and go back to normal after a migraine ends. We propose that an implant be located in the cheek near the parotid salivary gland and its associated duct. The proposed implant location is boxed on the diagram. The implant itself would be a patch that is made of PDMS that mimics the modules of the cheek tissue. The PDMS base would be coated in PEG to discourage nonspecific binding and prevent biofouling of the implant. As you can see in the schematic, the implant would be attached to the mouth with non-degradable Gore-Tex sutures. Antibodies that are specific to CGRP would be conjugated to this surface, and they would bind to CGRP in the saliva. The implant would be surrounded by a thin casing that is made with a polyurethane matrix that contains silver nanoparticles which possess antibacterial properties. To measure the levels of CGRP that bind to the antibodies, we would utilize a study that was published in Nature in 2016 about a semiconductor electronic label-free assay, or SELFA, that uses electronics to quantitatively measure ELISA results. This device would communicate with an app to monitor CGRP levels and report when levels rise to indicate a migraine attack. To reset the device, the patient would use a PPS mouthwash that would act as a wash buffer. PPS is often utilized for in vitro ELISA assays and would not degrade the antibodies or be toxic for the patient. To ensure that the antibodies remain specific to CGRP, the device would be replaced once per year.
The one benefit of our design is that it notifies patients about an oncoming migraine so they can take medication early. There's evidence of early medication preventing headache onset in over 80% of patients. However, 2/3 of migraine sufferers have no distinct visual aura before the onset of their headache, so they have no warning system. Of patients who do experience auras, over 80% of them also have migraines without auras. So by giving a warning system to all patients, our design will be instrumental in mitigating migraine symptoms. Another benefit of our design is that the software creates a form of personalized medicine by allowing users to log when they have migraines. We know that there's variation from patient to patient on the exact CGRP levels, so our device's software will adapt to know what the normal and elevated levels are for the specific user. One potential cost of our device is that it requires permanent implantation. However, our design is aimed towards patients who suffer from regular migraines, so the improvements to their quality of life should outweigh the costs of having a permanent implantation.
There are current treatments on the market for migraines, and these include acute or preventative medications. So an example of these would be the common pain relievers that are used, such as Advil, Tylenol, or ibuprofen. There's also preventative medications like a class of drugs called triptans. There's also the non-invasive vagus nerve stimulation. So in this treatment, there's a device that's outside the neck, and that's used to stimulate the vagus nerve, which is an important nerve in the pain pathway. So stimulating this nerve helps to reduce the migraine symptoms. And finally, there's this phenopalatine ganglion stimulator implant. So in this device, there's a controller that's used to activate the implant on the inside of the cheek, and then that implant will go on to stimulate the SPG nerve bundle, and this stimulation will help to alleviate the effects of the migraine. However, the problems with these devices is that there's no diagnostic treatments to warn a patient before the migraine happens, and there's no continuous monitoring for individual patients, lacking a form of personalized medicine. So because of the additional value we believe our device will bring to the market, we're asking you to invest in our device. Thank you.